origins in China approximately 3,000 years ago. It started as a system of observation because people got sick back then and they needed to get well just like they do now. And they really didn't have many tools to help a person out as far as getting well. So what they found is that people that had certain problems going on in their body also had pains going on in other areas of the body. That system of observation over many thousands of years was developed into a pattern called the meridian theory. Now the meridian theory is a channel called, they're channels within the body that have correlations between what happens on the exterior of the body and its representation of what goes on under the interior of the body. In Western medicine, we have the same correlations that exist in many different ways. A person has a heart attack and they get a pain in the arm. A person has a gallbladder problem and they get pain into their mid-spine. Well, the Chinese have taken it up and have studied it to a higher degree, and they found out that there was correlations between whole channels of the body and weaknesses in organ systems of the body, like the lung channel and the kidney channel in the body. And they have been utilizing this technique for many thousands of years, but it's only really been found out to be correlated or scientifically documented in Western medicine in the past 30 years. And the way that they did this is through electrodiagnosis. They found out that there were lowered resistance points in electrical circuits in the body that also correlated to weaknesses within the body. Also, what they did in the past 10 years is they took radioactive dye and they injected it into acupuncture points and found that the radioactive dye correlated with the acupuncture meridians of the body. And so it just kind of validated what the Chinese have been saying for 3,000 years. When a person, acupuncture is a tool of balance. Acupuncture can take an area that has chronic weakness in it and make it strong, or it can take an area that has too much energy into it, let's say an explosive headache, and pull that excessive energy from a region of the body and distribute it to another region, okay? So it has the ability, it's a tool of balance that has the ability to reestablish the normal flow of what the Chinese call qi, or your body's natural internal energy resource. Acupuncture incorporates the use of needles, and these needles are anywhere from a 1/4 inch long to 6 inches long. There's only a few spots in the body in which I would use a 6-inch needle, but I do use them. And it's for a person that has chronic sciatica, where we would be doing needling into the buttock area. But the majority of all acupuncture needles that we would be using would be incorporated on the sheet. And I'll pass this around so that you can take a look at that. All acupuncture needles predominantly, all acupuncture needles that we use at my center are single-use disposable sterile needles, and the majority used by acupuncturists nowadays. A person can autoclave needles and reuse them. However, I don't recommend it because there's a high degree of concern within the general public about needles and where they're coming for and potential infection and things of that sort. So all needles that we use are single-use disposable sterile needles. When a person comes into the office, what we do is there's an intense questionnaire that they fill out. And on that questionnaire, it includes, what your symptoms are and what bothers you, but also are questions that seemingly are unrelated to what your problem is. And the reason for that is that the Chinese don't have the same method of diagnosis that we have in the West. They're not looking just for, let's say, colitis. They are like a Western diagnosis of colitis. They are looking for a whole host of groupings of symptoms, that they have the symptoms of colitis and then a symptom of a low-grade headache in a certain region of the body, that they may have pain along a given region of the body. They try to correlate these symptoms, and if the symptoms correlate well, that means that acupuncture or traditional Chinese medicine is going to do well in the treatment of their given condition. So we have the Western diagnosis, and then we have in Chinese medicine what's referred to as a Chinese pattern diagnosis. Why that's important is that if a person is going to be helped by acupuncture, it is a relatively pre-diagnosable thing. If they have all of these parameters with that Chinese medicine treats well, they're going to make a very good candidate right from the get-go that they're going to get well from acupuncture, which makes it so that it's not, well, let's see whether acupuncture is going to help my given condition. There's a set number of parameters, and if those are in place, that person's going to make an excellent candidate for treatment. In Chinese medicine, we then go and we do a consultation with the patient. Then we're going to do tongue diagnosis. What we do is we look and we analyze the patient's tongue. We are looking at the coating of the tongue, the color of the tongue, the complexion of the tongue, and this gives us information on the internal environment that's going on in your body over a long period of time. Now, the Chinese have been studying tongues for thousands of years, and they have it down to whole science. And it tells a lot about what goes on internally. The next thing that we're going to do is take the pulse diagnosis. Now, this is not the pulse just like according to Western medicine, whether you have a weak pulse or a strong pulse, or whether the numbers of beats per minute. What they're feeling for is the way that the blood flows over and through the radial artery. This pulse diagnosis tells us about the way in which your body is functioning on an energetic level. The tongue gives us information on what the state of the organs are in the body, the static state, and then the energetic state within the body is how this pulse diagnosis. So if a person would go into Chinatown in the city to go to a Chinese herbologist, what they would be sitting there, they would be sitting and they would be having their pulse taken, and the Chinese doctor would be talking to them and taking their pulse at the same time. And that would give him information on the types of herbs that he's going to prescribe for the given condition. Okay? Also, what we're doing is a system of palpation. Palpation is touching, because acupuncture points that need treatment are tender to the touch when you touch them. So that's one indicator that a person needs treatment. Okay? Most things within Chinese medicine treat easily, and they treat quickly. The majority of things are treated in 6 to 8 treatments. If it's an easy thing, it's even treated sooner. If a person would need more treatment than that, they would be well on their way to getting better by that point in time of the 6 to 8 treatment. If more treatment was indicated, it would be clearly indicated that person's getting that much better, even with a chronic problem. Meaning a person that has something that's a fresh problem, a sprain or strain of the back, or a very, very new condition, that's going to get well quicker than something that's chronic or long-term. And that may require more care. However, they'll be well on their way to getting a symptomatic change, regardless of whether the problem is chronic, or meaning new or old. Okay? An acupuncture treatment, there are different styles of acupuncture treatments. Some are quick and some are long. The majority of treatment that I render, it takes about anywhere between half an hour and an hour. I find that the longer the treatment, the longer the effect that the needles stay in the body and have an effect on the person, the stronger the medicine. Because acupuncture helps healing in numerous different ways. Number one, it does what I mentioned before. It either is bringing energy into an area or taking energy away from an area, redistributing balance according to the meridian theory in Chinese medicine. The secondary thing that it does is it has a natural anti-inflammatory effect in the system. The other thing that it does is that it increases endorphin formation. Endorphins are hormones that are generated by the body that create an overall sense of well-being. The other thing is that it can lift up the immune response by lifting up what's called your B cells and T cells in your body. And this is a response that's a protective response that helps in the healing of autoimmune problems, or whether a person's sick, having a cold or flu or something like that. Okay? So in a moment, we're going to talk while we start and do our acupuncture demonstration. I'm just going to touch on Chinese herbal medicine for a moment briefly tonight. Lately, it seems that people are taking a lot of echinacea, whereas that seems to be the herb lately that people are kind of getting acclimated to, and it's a wonderful thing. echinacea is not meant to be taken by a person all the time. You are not strengthening your immune system by taking echinacea all the time. It should be taken more in the winter than in the summer. It should be taken if you feel the onset of a cold or you feel that your body is in a weakened state. That's when you need to take it. It really shouldn't be taken for more than a 2-week period of time at practically any time, because it doesn't have a continued immune strengthening effect for you. So it's when you need it or you feel in a weakened state or vulnerable, that's when you need to take it. Okay, that's important to keep in mind, because some of these things, it's not like a lot of Chinese herbal medicine. It's not like a Western supplement, like, oh, I take vitamin C, so that may be something you're taking all the time. It's meant to have a beginning, a middle, and an end to it. It is not a continued effect. But if I didn't, what I wanted to go over tonight was to bring this into awareness. It is astragalus. Astragalus is another Chinese herb that has a very similar effect as far as lifting up one's immune response. If you feel the onset of a cold or flu, and you take this particular substance, it will come either in a pill form, a powder. You can, well, it's not very common in teas, but you can get it in, like if a person came to the office, we would give it in a raw form, or they can make it up. But it comes in many different ways that you can purchase. You can actually knock a cold or flu out of your system before it has a chance to actually get inside of you and stay inside of you. Now, everyone should have this in their own home. You should have this in your medicine cabinet. So when you feel cruddy like that, you take this. There's a very good chance that you may not have to live through that weakness zone, whether it's a flu or any form of bacterial infection. You may drive it out of your system. This is the first thing that you should reach for, as opposed to a decongestant or some of the or NyQuil or something like that, because that's just helping to squelch your symptoms. It's not necessarily going to help you get out of it quicker. So astragalus is the name of the herb. That was the herb that I want you to walk away with remembering tonight. Astragalus.
Can you tell us how to spell it?
A-S-T-A-R-G-A-L-U-S.
Thank you.
Okay? So that's what we're going to keep in mind tonight.
Can you remember the name of that?
Henry, where are you at? Oh, Henry is going to be our first demonstration tonight. And Henry has been a patient of mine for many, many years and has come in intermittently. He has lower back pain. He is a carpenter for a living, and he suffers from throwing his back out on occasion, sciatic neuritis, which he's not experiencing now, but he is, I thought, would make a great subject because he's real big and real strong, and we can get right into him. And I got some real meat to get. Henry, I'm going to need your shirt off, sir, and we're going to get you into assuming the position. This first treatment that we're going to do tonight on Henry is a treatment for myofascial pain, and it's also for chronic back pain. This would be utilized for someone that has chronic fatigue syndrome that has then developed over a long period of time and gotten into the muscles, where we get a fibrous muscle tissue, or like grizzle that builds up into the muscle, just like if you're going to have a piece of meat that had a piece of grizzle in it. That's what's going on with people that have chronic myofascial pain. They're getting grizzle in their muscle, and that causes this pain that they never seem to get rid of. So it's very good for that. A person that's had Lyme's disease that gets untreated for a while, it develops into muscle, gets into the muscles and can often develop this type of pain. Also, this is very good for chronic sprains and strains, the technique that we're going to do. Now, a person comes in and we do acupuncture needling. The amount of needles that we use may be anywhere from 4 needles to 80 needles. On average, I use about 20 to 24 needles per treatment, and just be looking at what I do on the average. It's not always the more needles, the more effective the treatment. It's not always that correlation. However, when we're treating myofascial pain or any musculoskeletal problem, or what's known in Chinese medicine as a B syndrome, then the more needles, the merrier. Now, acupuncture doesn't hurt. certain points are tender to the needling process. Now what occurs is that when the point is tender, that person will be slightly tender to the needling process as we first start. And then the chemical effect starts to take over the body. The needle has the effects on the nerves and the surrounding muscle tissue and creates an overall sense of quiescence. So I say. Now, the interesting thing to ask, well, how deep is he sticking those needles in there? Depending on the spot that I'm needling, will go in either a 1/4 inch or anywhere up to 3 or 4 inches. The majority of needles go in are in at about a 1/4 of an inch, about that far. Okay. Depending on the type of tissue and the location, depends on the depth for treatment. These points are very good for people that are asthmatic. These are the points that we would needle for chronic asthma or people that have emphysema. And the reason is that all of these people, they get very tight up in here because this is the reflex nerve supply areas within that region. So we are affecting not only the nerves that are coming out of the spine, but the surrounding muscle tissue. Now, acupuncture has points all over the body. And some of the strongest points within acupuncture are not necessarily the points that are the closest to where the pain is at. Many times a person will come in and there's points that we're going to be needling in their feet, in their head, in their ears, in their arms, that the majority of them are going to be away from where the source of the treatment is. When a condition is excess, or meaning too much stimulation within a given area, once we start to needle, we'll know that the treatment is effective and going right. And the reason why we know that the treatment will be going right is that Ming Men, the best point for lower back pain here. We know that the treatment is going right because we'll see what looks like a little red point, like a little bullseye around the needle. That indicates that the needle is having its surrounding chemical effect on the tissue. Very desirable.
Has he felt one of those needles go in?
Henry, what is your response to treatment at this time? Oh, I like that. It's due to the good needling technique of Dr. Golding because he's such a smooth character in this regard. Now, this isn't many needles right now, and I'm not going to belabor too many needles on Henry. Normally, I would be taking these needles, and I'd probably be using about 30 or 40 throughout the course of his back for chronic myofascial pain. And then I would be using about another 10 to 15 needles, which are going to disperse the energy within the body to different regions of the body. And a person can feel it because we want to demonstrate, we want to initiate flow within the course of the body. Now, what I'm going to be doing is I'm going to stick needles in his ears. This is known as auricular medicine or auricular therapy. This was not originally developed by these. This was developed by a Frenchman known as Nogier, who studied acupuncture in Vietnam and developed this subsystem of acupuncture. Why this is very, very important is that these points are very strong and has nothing to do with the meridian or channel theory within acupuncture. What this has to do with is different locations of your ear reflects back to the vagus nerve. The vagus nerve is a head nerve. It is a cranial nerve. It is one of the most important cranial nerves in dictating function of what's known as the sympathetic and parasympathetic nervous system of the body. The sympathetic nervous system is a portion of the nervous system that wants to speed things up, to make things go faster. The parasympathetic nervous system slows things down so that things are regulated better. People that have heart conditions that are fairly aware of the relationship with that. It's the biggest relationship between the Western understanding of medicine and the Chinese understanding of medicine, between yin and yang. slow and fast. And that's the Western representation. So we are overlaying treatments of the body. We're treating both the local area, and then we're overlaying the treatment with auricular medicine. It's important because we can help to manage pain with this, and sometimes what we'll do is that we'll electrify the needles. I didn't bring the instrument. We take an electrical current, and we have a machine that will magnify the effect on the acupuncture point if the point needs to be stimulated to allow for release in a chronic area. The other thing we may utilize is laser acupuncture. Laser acupuncture is very good for the management of chronic pain. Laser acupuncture is very good for needle shy, and it's very good for children who, a lot of parents are leery, well, I don't know whether I want to bring my child for acupuncture because they don't like needles so much. So we would utilize that. We would utilize that in children. Okay, Jim, you're going to put your shorts on. You get your shorts done. Bernadette, come on up. This is Bernadette. Bernadette, thank you for coming today. Bernadette works for me, and she has opted to be part of our demonstration model today. Bernadette, I'm going to need your shoes and socks off today. The treatment that we're going to do for Bernadette today is a treatment that is going to be for weight loss. And I hope to explain why a person would come to an acupuncturist for weight loss, because they may understand how acupuncture may help some of these other conditions, but what's this all got to do with weight loss?
Sorry? I said, you don't look as if you need any short hair.
Yes, she doesn't.
Weight loss.
Volunteer.
I'm going to do a very simple technique, and it's a treatment that the Chinese call the 4 gates. And the 4 gates treatment allows for the opening of the energy cycle, or the normal flow of energy within the body. Having rendered thousands of acupuncture treatments and having people experience all kinds of reactions, this particular 4-needle technique, prior to doing the auricular medicine, brings on tremendous change in people, more than any other acupuncture treatment that I know of. I do this treatment, and people, they experience many results on both a physical and emotional level. They feel like a release. Now, we are going to be needling a point called liver 3. Right there. Is that tender for that? Good. How about here? Good. Liver 3 is between the first and second metatarsal. This is a very good point for people that have anger and frustration in their lives. This is a very good point for people that have headaches, a menopausal or premenstrual tension. It's a terrific point for that. And this is known as large intestine 4. This point is very good for headache. It's very good for any sinus or any upper facial related problem. Dentists that utilize acupuncture as an anesthetic for when they do their dental work, this is the point that they work with. And what they'll do is that you'll go into the dentist's office, he'll put these 2 points in, he'll manipulate these points, go out to treat the next patient, come back, manipulate these points for a little while, and then start to do the drilling. And many times this will totally anesthetize the area. Yeah, but this is the point. This is also the point, if you read that they tell you if you massage it, it may help with a headache or help you with these symptoms. But it's usually tender if you have a headache, and it will always be some degree of relief with that. Now the points that we're going to be doing in Bernadette's ears, this is known, I call it the epistat point. And this affects a portion of the vagus nerve that suppresses the appetite It increases the endorphins so that the person has an overall sense of body well-being. Now, what's involved with acupuncture for treatment for weight loss? Usually it's about 3 to 4 treatments. Now, that doesn't mean that the person is going to lose as much weight as they need to lose in those 3 or 4 treatments. 3 or 4 treatments are needed as far as an in-office procedure goes, and this is usually rendered at a frequency of once a week. What we want to do is clear all of the meridians or channels in the body, so a person that has a sluggish metabolism, then we're increasing their metabolism. They have no longer have these blockages in the body. They're free and clear of this constriction involving Chinese medicine. So then what we do is that we use then when we do the auricular medicine, we will use acupuncture points and needles that stay in the ears. So on the third treatment or potentially the 4th treatment, there's a needle that will lie in the ear, but it's kind of like a tack. It lies flush with the ear, so it can't go in, and it's not sticking up, so you're not going to poke it or anything like that. With that, we may leave in anywhere from weeks to sometimes months. Sometimes we'll change it, but it can stay in for that longer period of time. Sometimes that needle needs to be stimulated, and that will have, like if a person develops a high amount of hunger, they can stimulate that point and they'll feel better with that. Okay.
Doctor, is that the same spot that you put someone who would like to quit smoking?
No. There are literally, in the body, there are 360 what's called acupuncture points in the regular meridians. That's separate from tender points in the body, which we may also needle. In the ear, there's about 150 to 200 different points, and they're very, very close. They're all around the circumference of the ear. So it's a whole study in and of itself, memorizing those points and their location, and the balance of those points between one side of the body and the other. There's points that you have to needle if a person's left or right-handed before you start the treatment. So there's a lot of neuroanatomy associated with it, not just acupuncture, sticking a point in and forgetting about it. Keeping in mind too that a weight loss treatment may not be, the points in the ear are the same, but the points that happen in the body may be different from individual to individual. And depending on what their makeup is, as we were talking before, as far as their analysis goes. Sometimes we'll use as many as 6 to 8 in each ear. And usually a person will start to feel an effect. They'll feel like initially a flushness in the ear, like their ears are like you're getting real hot. And then gradually they'll feel like a quiescence come over the body. Very, very powerful acupuncture point. Okay? Any questions right now regarding this before we go on to the next?
Is there a diet after this?
Acupuncture, if a person isn't eating excessively, they'll lose weight even without tremendous dietary change, just as long as they're eating a normal, healthy diet. Although when a person comes in, I'm attempting to modify their diet simultaneously. So, because we have statistics on the average amount of weight loss, if their diet, I always look at their diet. If their diet's okay, and they're doing this, I can tell them pretty much what they can expect to lose and the way in which you'll lose it from the acupuncture alone. If I switch their diet, it's extrapolated. We can tell them pretty much what they can expect to lose weight-wise if they follow this particular diet based on their body typing. Some people are more of what they call endomorphic or have a sluggish metabolism. Is it a thyroid condition causing their weight loss, or is it just bad habits? So we try to take in everything into the mix. We don't put our blinders up and say, well, this is Chinese medicine, and we're going to disavow everything that we know about Western medicine and just normal physiology. It's just that we're trying to torque things up. Sometimes a person has, with weight loss, their body is so efficient that they start to eat less in diet, and they still stop losing weight because their body adjusts to get more out of less. And for those people, this is an excellent tool because it decreases their appetite, it makes them feel better, and that natural tendency of when you feel better, you also want to exercise more and do more activity and all of these things. Okay? Yes?
Can you use pressure points in the ears to control pain in other parts of the body?
Yes.
Okay.
Yes. There's many medical doctors that just do auricular medicine, or this form of ear medicine. And what they do is they have very sensitive diagnostic equipment that the differences between a millimeter is that they know they're affecting a different portion of that nerve in the cranial center. And this has a greater overall effect. Sometimes it'll electrify the needle into the ear too, than to have an effect on anesthesia. Last summer I was in China, and one of my main reasons for going was I was interested in acupuncture anesthesia. And so that's what I spent the summer doing there, was doing acupuncture anesthesia, because in my mind I said, if I can learn to anesthetize a given area and become very good at not only pain control, I can do anything else that acupuncture can do. You know, because I thought that would be the highest level. If I could anesthetize a given area, that I would have the highest level of control that I could get utilizing that tool.
So perhaps putting a needle in the ear is better than what this gentleman is getting? Is that?
I have needles in his ear.
Right, but also throw his back.
No, well, they're
So-
two different systems. One is traditional Chinese-based meridian acupuncture,
Yes.
and then I'm introducing also auricular medicine. I usually do two, because both of these approaches do not counteract one another. They don't conflict. There's no contraindication to doing both, and it increases the likelihood for success to a larger degree. So why should I? I want to do everything I can do to help that person get better quicker, utilizing that tool. So I usually always will double up on that if it's not just a local problem. Sometimes people will come in and they may just have a sprain, strain, or given area, weak ligaments in just a given zone. It is due to some type of pull or strain. Well, the majority of where we're going to do the needling may be local at some distal points. But when a person has an internal problem, some type of organ dysfunction, and that's interesting, that's a very good point to mention this, is that most of the people that come into me, let's say with an internal problem, they've had fibroids, or they have endometriosis, or they have a long-term history of colitis, or breathing problems, or some type of gastric dysfunction. They're usually coming to me after they've had a full Western diagnosis, or all of the tests. Or if not, I order the tests myself, as far as what I'm allowed to order. If that person needs blood work, I get them the blood work. We rule out. We don't want to miss something that is best treated by other means. But when a condition, let's say these conditions come back and they find, well, we can't find out what's the matter with you, and there's nothing structurally the matter with an organ in your body. That's where acupuncture does its best job, because acupuncture helps to control function and regulation. And that's the tool that we're looking to do. It's not necessarily a disease eliminator. And that's the reason why so many people come for acupuncture who don't necessarily have a problem. That's not the majority of what I treat, but sometimes people come in, they have like an annual thing, there's like an annual visit where they go to their MD, they have their annual acupuncture treatment, and they utilize this as a tool to treat the yet disease. It's what they don't have yet, but they think that they're going to have if their channels or dysfunction or tightnesses or constrictions continue to exist within the body. So what we do is attempt to eliminate these abnormalities using Chinese internal herbal medicine and utilizing the aspect of acupuncture. And so it's a tool of regulation, it's a tool of balance. Jim? Yep, come right up. I'm going to need your shirt off today, Jim, and we're going to get you stretched right on the back. Now, Jim is an actual acupuncture patient of mine, and we're going to be on your back today. And we're not going to get too much into his personal medical history, but we're going to do some treatment that revolves around where weaknesses have been present in his body. Is that comfortable like that? You good? Got some type of, where's your coat, Chris? Yeah, just put that on. zipper down. Now, it's very interesting in China because people will utilize acupuncture for practically every given condition that they have. It's not, and there is an acupuncture treatment for everything, and not that acupuncture treatment is going to correct everything, but it's just so much a part of the way that they live, this whole thing of regulating the balance in your body, is that since in China they don't really have to pay for medicine, so they used to not have to. So whenever they get an ache or ailment, they're usually going to the doctor very early on. They're not waiting for things to really develop. Also, they don't go to private practitioners there. They go to a hospital. So when they feel the onset of the cold, they go to the hospital. I mean, there's more people in China than there is things to do. So there's all kinds, they will go right to the hospital, they get their acupuncture treatment, and they get to do all of these things as far as preventative medicine goes very early on. So it fuels very much into their lifestyle. Now, the difference between the treatments here tonight is, in Henry's treatment, this would be a treatment that we would use dealing with a problem on basically the exterior of his body. We've got a musculoskeletal weakness, causing him chronic pain, so we're trying to eliminate something going on the outside. In Bernadette's case, we are trying to normalize the flow of the energy in her cycle to influence her metabolism, to increase the weight loss, and do auricular medicine to affect her metabolism over a long period of time. In Jim's case, we are doing more, so this is what the Chinese would refer to as a yang treatment. This would be a regulatory treatment, and this treatment is going to be a yin treatment. A yin treatment is going to affect predominantly the internal portion of the body. We're going to be affecting his digestion, and we're going to be affecting his liver. A lot of what Chinese medicine is very effective in treating all kinds of liver-related problems, and something they're doing more and more here of in the States is that they treat hepatitis very well, and they control hepatitis very well using acupuncture and Chinese medicine, and they also so it's just kind of coming online because we really don't have the treatment so much for it, and so it's managed very well using acupuncture and herbal medicine. Also, what happens is that in our society, we build a lot of tension or frustration dealing with our fast-paced society. This tension or frustration creates a lot of heat in our body. And the heat frequently will transfer up to the head. And that heat going to the head creates cloudiness of memory, lack of judgment, a lot of people will experience anxiety, frustration, and anger. No, but you wouldn't think so much that coming to an acupuncturist to treat your anger, but it's one of the best things to do because it can really help to regulate chronic anger and frustration. $1 million may help too, Winona, but I'm not This point that I'm needling here is called spleen 6. On the model, it is right here, one of the most powerful acupuncture points in the body. Spleen 6 is very important because it is the meeting point of all of the internal organ channels of the body. So if we want to have a powerful effect on the way that the organs function in the body, we're always going to needle at that point. The other points that we're going to needle is called triple warmer 5. And triple warmer 5, 2 sun up from the wrist crease, this is the primary immune spot of the body. So a person that comes in and they either have an age-related problem or digestive or a bacterial problem or some type of chronic immune system weakness, we're always going to be incorporating that.
Is that helps diabetes?
Well, Within Chinese medicine, there are 3 diagnoses for diabetes, and they categorize them by what is the greater portion of their symptoms. Are they more thirsty than they are hungry? Do they have a bigger frame, or is their body wasting? Okay, the Chinese refer to the disorder as a thirsting or wasting disease. So the points that we would needle and the diet modifications would depend on which one of those categories of thirsting or wasting is true. They're very good it's very good in regulation of one's sugar level. It will not replace I think it helps very good in keeping people that are on oral insulin from ever needing to go to injectable insulin. It does a very good job with that. It works better on adult onset diabetes than it does on infantile diabetes. Those are just just blatant facts that I know about it. This point here is known as yin tang. Yin tang is a point that I add to a lot of treatments if they have a lot of emotional tension going on in their body. The points that I'm doing in the head, this is known as sheshen tang. And these are 4 points in the head that we do for people that have memory problems. So I hope I remember where to put these points.
Now, what are you treating him for? What is that?
We are treating him for a diagnosis within Chinese medicine known as constrained liver qi. And this is the combination of having a weakness in your liver, having anger and frustration, and problems dealing with fatigue and energy of the body. It's caused frequently by overwork and exhaustion, a lot of emotional stress and tension and pressures in someone's life. And what will happen is that this is a very good treatment for people that feel a lot of congestion or have days in which they have days in which they feel wonderful and they're just terrific, and then for no good reason they follow all the same habits, and they have days in which they feel just they can't concentrate, they're upset, they have really terrific swings in the nature of their mood and behavior. This helps with that, and it's wonderful for depression. Depression, weaknesses within the liver channel relate to premenstrual problems, gynecological problems are frequently symptoms that revolve themselves within this liver channel. How are we doing, Henry? You wishing I would have done you last there, or? Now, this is a procedure that we're going to use. This is known as cupping. Cupping's been around for thousands of years. It was originally developed by the Chinese, and I'm going to do its modern form, and then I'll do its old form, which is using glass cups. What this helps to do is it increases the circulation in a given region. It helps to eliminate swellings around the joint. It's very good for pain management, and it's good for predominantly local pain. Like a person has a shoulder problem or localized pain where the needling is not going to do it. Now, depending on the condition that we're treating, cupping, we can use cupping all over the body, but the points in which we use it, and it doesn't hurt. It doesn't hurt. It will create what looks like a hickey for a while when we're done. The treatment itself can stay on for anywhere from just a few minutes to 10 or 15 minutes. A lot of times we'll use the cupping over an acupuncture needle. So we're trying to affect that acupuncture point more if it's a point that we really need to stimulate in a manner and bring the activity in and out of that area. And frequently that site will be very distal, meaning very far away from where the person's condition is at. And one thing that's good about it is that they can usually feel a difference in their condition at the end of the treatment when we utilize some of these things in combination. Now this part is where I burn the circus tent down here. Right there. I just wanted to demonstrate the more traditional method. If you can see how much more suction it generates than the actual other tool. This is a technique that the Europeans still use to, it was brought back to Europe from China, and it's something that is utilized a lot for dispersing for a cold, or they have some type of bacterial weakness in the system, or they have some type of chest congestion. They do a lot of, they'll do a lot of this. Okay. So you can get a really good suction going, and then I have these in like a million different sizes. So depending on what I'm doing and involved with them, if I got the time. Oh yeah, sometimes it'll turn almost bruising in nature, but usually it goes away just in a few minutes. Depending on a person's complexion, they may have a red mark that stays a day. But some of these things I don't use on everybody that comes in. You know, it's not like I'm doing this, creating bruises on people every day. These are for people that, I had a woman I just treated recently, had capsulitis of the shoulder. It's a frozen shoulder, okay? She had came to see me after 3 months of physical therapy and was worse after all that. She had cortisone injections into the shoulder. She had anti-inflammatory. Was debating of whether to go under surgical, anesthetic manipulation of her shoulder to, try to loosen this thing up. And I did acupuncture for a few visits. It had only partial relief. I started to use the cupping into her shoulders. I used about 6 cups on her shoulders. We did that for 3 treatments, and her range of motion in the shoulders, it's like she's flopping in the shoulder now. So it was very much indicated for that condition, and it's just another tool that we utilize. Now, the other thing that we do is that we talked before about utilizing acupuncture needles to stimulate or bring energy into an area that's deficient or weak. Another tool that we may use is called moxibustion. Moxibustion is the heating of an herb called artemisia. It's a derivative of a chrysanthemum, and this particular herb has a peculiar effect on acupuncture points, where it creates a physiological effect that's different from if I just added a heat source to an acupuncture point. They've measured this. It has a strengthening effect on where weaknesses are. So this herb is a preferential thing. So the herb is in here. We would light this, and then we would run this over the acupuncture point. Usually I will give these for patients to use at home, because it's not something that they need to come and pay me for to do in the office. So they can do this as homework. This is smoked moxa, so this will generate a lot of smoke. It also comes in a form in which is smokeless, and then they can do and work on the given points. I give them homework to do between treatments, so that it cuts down on the nature of the care that they have to get in the office. Moxa can also be applied in many different forms. Like we have a little miniature moxa sticker here, and we're going to burn the herb directly on the skin. Henry.
Oh, we got tough stuff.
And what they do is they take the herb, and then they put a hole in the bottom of where the sticky area is so that you can put it on the point in question. And then we will stick these on the areas involved. So what happens is that the herb is penetrating at the acupuncture point in question. This can be utilized all over the body. We will also use moxa threads, which are very small sticks of moxa that we will go and we will put directly on the point, and we will burn it right into that point. The heat flash or the heat source happens so quickly that you don't even, that it feels like a warmth or a heat, but it doesn't burn you. Okay, it's not like it will leave a welt on you or anything like that, because it's just almost like a flash source. So it comes in many different forms that we do this with. How are we doing, Henry? Is it feeling warm with that? You feel that point?
Not really.
Okay, good. Usually a person will start to feel, these will burn all the way down. Anytime we use moxa or do this type of process, we're usually in the room with the person. We're not leaving them unattended. That's good. Okay, so this is a cupping procedure. This is an acupuncture procedure. This is moxibustion, the actual heating of acupuncture points for conditions that are either the presentation of the person's condition is cold. So we would use moxa for a person that comes in, which is frequent. A person will come in, they may be older, younger, their arms and their feet are constantly cold. And that's what they present with. And you feel them, and they're cold. Their feet are cold, their hands are cold, they're cold, they're cold. You can put all the heat on you want on them, and it doesn't seem to make a difference. Or gloves, this, that, doesn't change it. We do the acupuncture and moxibustion directly into the hands and feet, and it changes the total circulation and the way that the physiology reacts in the area. It's spooky the way that it works, but that's one of the things that it treats best is because it's a functional tool of balance. It's like another one of these things I'm talking about in regulating the tools, regulating the things in the body. It's also terrific for people that are diabetic. In mentioning diabetes, diabetic neuropathy. So we would do a lot of needling, a lot of local needling into these regions. It calls a lot of attention of the nerve supply to increase nerve healing into these regions, decreases inflammation, and increases the blood flow. Not that it takes arteries that are closed down due to cholesterol or hardening of the arteries. It won't undo something that's occurred over a long time. It just changes the physiology of what can happen in that area. It doesn't even mean that a bad area that's only functioning at 10% can't function a little bit better if it's relaxed and expanding, have better blood and nerve flow. So it gets back to this tool changing physiology of the involved region.
Is that
Okay.
like heating pads on physical therapy?
Well, that's good. That's very good that you mentioned that, because you say, well, why do all of this heating of this given point? If a person's cold in that region, why don't you just take it? You get in a whirlpool, you put a you put a heat source on a given region, or relax a large area. That is just a different form of therapy. But if you're looking to affect acupuncture, or if you're looking to use Chinese medicine, utilizing the one pathway, it's a direct pathway from outside of the body, inside of the body, not just affecting here. We're now affecting, with points that we may affect symptoms that are far-reaching in the body. So many times when people come in, if a person comes in to see me and they have a raging migraine headache, I rarely do any acupuncture treatment up and around their head. I just needle their feet. I'm needling around their feet, I'm needling around the lower portion of the leg, and they will feel that tension, that stress, and that depletion drain from their head. And they tell me it all the time. Like when I had a really frustrating day, just like I'm tight. We'll do this needling, and you relax there for a few minutes, and it's different from relaxing. You can feel it go. You can feel it leave. And you know, that's the reason why it's applied to a very specific point. It's a gateway. And that's one thing that acupuncture does. It's a gateway from the outside the body, inside the body, having an effect on it physiologically. Yes?
Can you treat the external, like if a person has multiple problems, can you treat external and internal problems in the same treatment?
We can treat external and internal problems in the same treatment the majority of the time. The only time that you couldn't is if the treatment, if the types of treatments that you have to render for the conditions conflict with one another. You may, so that may not happen simultaneously, but we may treat a person in one position, doing needling in one region first, and then within the same visit, we may change that strategy and change the way in which we're going to do to influence the other condition. Because if it binds up with one treatment kind of goes contra to the other, it may neutralize the effect that you're going to have treatment-wise. But then there's other conditions that they treat wonderfully together. You can treat things simultaneously. And that's one thing that we like to know when a person comes in. We don't try to dig for symptoms. Like, you know, a person comes in, they got something in mind that they want treated. But since there's this pattern diagnosis going on, a lot of times the things that they thought weren't related are very much related. The other things that happen is that people come into me and say, "Doctor, I'm coming into you because I'm falling apart. I was totally normal 6 months ago, and now I have a weak back, I've got urinary problems, my bones are hurting, I can't concentrate, I have memory deficiency," and they're thinking that they have all of these different things. They get this, they get that, the doctors, they get medicine, whereas that whole thing may be one particular Chinese pattern diagnosis that within this medicine, that's what we treat as just one thing. So then it's a wonderful thing. We've taken it and we put it together, these grouping of symptoms, you treat it and they all go away. As opposed to these people that some of them have to end up doing chronic doctoring because they're doctoring for one thing and doctoring for the other thing, and it really was one thing, but they're getting, you know, they're on medication for depression, and then they're still getting PMS, and then they're still, you know, they're still having breast distension, you know, well, and these are all groupings that go with one pattern. So if we would have gotten a hold of them, and that's part of what we're doing tonight, is that Chinese medicine may not be the first thing that people are going to run to, but what we want to do is increase everybody's awareness to allow for this to be something that you may consider, especially if you're not getting well through something that you would first go to, or to know what this treats best as far as conservative care goes. Because, you know, I've been a chiropractor for 19 years, and there's many times there's been conflicts with the way the chiropractors thinks versus the way that the established medical treatment exists. Okay, it's been going on for a long time. I mean, chiropractic has pretty much a natural mindset for the majority of the time. But for as much of a difference and difficulty I had with those two disciplines, the MDs, they just embrace Chinese medicine. I get so many referrals. Most of my patients come from medical referral because I'm not sure whether it's the fact that doctors love needles, so it's very easy to say, "Wow, geez, let's send them to the guy we do needles." I like that. Let's send them to the guy that does needles. They refer like no tomorrow because they get all of these patients that they want to just almost get rid of. They're tired of seeing Miss Jones coming in. "Listen, we can't find anything. Your blood is normal. Your tests are normal. There's nothing more I can do." Send them to Dr. Goldberg. And they're just as happy as can be because their problem, it gets back to what I'm saying, it's functional. It's not, or physiological. It's not anything that they can do. And there's a lot of stuff out there, and that's what we want to see. Yes?
If a person is on medication for a diagnosed illness, can you work in conjunction with that medication, maybe to treat side effects?
There's no contraindication to utilizing acupuncture along with Western medicine. And a lot of Chinese herbal medicine works in conjunction with Western medicine equally as well, with very minimal side effects. Out of the hundreds of herbal preparations that I know, it's extensive research. There's only a few things that really conflict that, like, oh, but you don't do that when you're doing that. Most herbs, like there's 500 herbs that are used in the Chinese medical, pharmacopoeia, and most of them come from China. Not all of them do. Most of them come from China, and I get them in the raw form, and we'll either give them to people in bags to make for teas, or we'll prepare them for them in the office. We have specialized herbal pressurized herbal cookers, and they'll go home with a thermos of it. I usually don't buy the pill forms of medicines. I have the raw herbs bought in, and I have the pills that are made in America, just because we have higher standards as far as processing of things go. And part of the problem with the actual Chinese herbs that are brought in, the Chinese have a different philosophy. They don't have any money there. So, I mean, when I was working in the hospital and you ask for a cotton ball, that's what you're going to get. They don't use disposable needles there because they can't afford them. The needles are sterile, but they've been used hundreds of times before. I mean, they're about as dull as can be. I mean, just because the resources are so limited for the people that are there. They manufacture what we use, but they don't use what we use. Because they can't afford that. So what they did, which is it's a totally different philosophy there. The Western medicines are expensive. The herbal medicines are cheap or free. So what they would do is they would take a little bit of the Western medicine and put that in with the herbal medicine, because they found that the Western herbal medicine, when taken with the Chinese with the Western medicine, is magnified tremendously by the effect of the herbal medicine. So 10% of what, when we do an analysis of these patent remedies that come from there, 10% of it's Western medicine, because it's been adulterated to transform it to a higher state with the Western medicine and the Chinese herbal medicine. Now they look at this as a very good thing. We've taken something that is the best of all over and made it better. But I don't do that. I don't use that in that manner because, number one, we're much more conscious that if you're taking an herbal preparation, it's because you don't really want to take something else. And you may have some type of sensitivity to Western medicine, and that's the reason why you're taking the Chinese herbal medicine. So they don't look at it in the same way. They look at it, look at what we've done. We've taken something that's good for both worlds, and we've made it the best it can be, utilizing the smallest of sources. So 15 to 20% of all Chinese patent medicines coming into the country are adulterated in that manner. But it's getting better. I mean, if the herbs imported, made here, you buy the pills and stuff that are made here. Yes.
I wondered in Henry's case, how come you didn't use the chiropractic method on him?
We do. Henry's never had acupuncture before.
Oh.
Brave man. I called him up last night. I said, who'd make a great back right here? Henry, who's got the biggest back I know? And that's it. So Henry's here. No, Henry responds well to chiropractic care. And I don't know whether acupuncture would necessarily be his first choice. But I thought he'd make for a good demonstration. But these are the areas and regions that do bother him. So I figured we'd do demonstration and we could really make it hang out. And
There is nothing better than the other? I mean...
Well, there's a lot of situations. When people come to me, they may be coming for chiropractic care or they may be coming for acupuncture. Now, I don't do a thing where, like, it's my way or the highway, like you have to come in for what I want to do to you. I will recommend to a person that I think this particular treatment may benefit you better than this. And there's certain things that acupuncture treats better. There's certain things that chiropractic care treats better. I mean, if a person came into the office and they had sciatic pain, radiating buttock and leg pain, chiropractic is wonderful at treating that condition, and the majority of the time it treats very simply and easily using chiropractic care. So why do something that's gonna require more treatments when they don't need it? They're gonna get well from chiropractic. There's other times that a person comes in, doctor, I've been going to a chiropractor for 2 months for this sciatic pain. I haven't seen a darn bit of difference. Well, if the chiropractic care hasn't changed it in that period of time, you know, more of the same thing isn't gonna help it. So then this may be a treatment this may be the treatment of choice, because what will happen is that the condition may be caused by chronic constriction or weakness in the involved area. So we take a weak muscle, make it strong, or we make something that's really deep and in spasm and just won't let go. I put a needle right to it. And we can do what's called a trigger point release. And a trigger point release is that when you hit the certain point on that muscle, you can massage it all you want. You can electrify it, you can do all these things. But when you hit this trigger point in that muscle with that needle, the muscle will fasciculate. It'll go just like that. And then the person just like, oh, it stopped. It's, you know, and they did, oh, it stopped. And it could have been there for weeks or months. So, I mean, a trigger point release, a myofascial trigger point release, that's more of what we would consider to be medical acupuncture, because the MDs that utilize acupuncture don't go so much along with don't do so much traditional Chinese acupuncture. They're just doing, look, it's sore there, let's stick a needle in there. It's sore there, you know, this is more of what's considered to be like medical acupuncture, is this trigger point release. But we do that too. Yes?
I'm curious, when I've seen acupuncture done on, you know, a TV show or something, they usually did a lot of, they were spinning and twirling the needles, and you just put them in and you left them.
No, well, that's called stimulation of the needle, and I do a lot of that. It's just I find I can't talk and chew gum at the same time. Frequently, I lose my concentration a little bit. There's many different techniques of stimulation of the needle. If an area is constricted, let's say you have a muscle spasm, we may move the needle in a way in which we're looking to find that point inside of there that's going to cause the physical release. There's rotating of the needle and fasciculating of the needle like this that will take an area that is deficient or weak and call the energy back into that area. And that would be a different form of stimulation. So the types that we can do is either to disperse, meaning to relax an area, or to enhance an area, to bring the energy back into the area. So yeah, we usually will always do some form of stimulation to the needle, whether it's heat the needle, manipulate the needle. I usually will do manipulation of the needle when we're inserting the needle, okay? Because what will happen is that when you get good at acupuncture, you can actually, it's almost like fishing. You can stick the needle, there's the prescribed point for acupuncture, you know, like that point according to 2 sun up from, and this is just over here, that's the anatomical point. But that whole point may have slight difference physiologically between one person and the next. And that doesn't mean it's going to be over here, but on him, that one point may be there, just because we're all born a little bit different. So what happens is that you can feel the actual tug on the needle when you get the sensitivity there. It's almost like you're being sucked into a void at that point. It'll grab on there, and you'll feel that's the point. Many times a person will feel it's not hitting a nerve because it doesn't go, let's say you hit a nerve and it shoots down your leg, like the nerve is just like it's coming in contact with the nerve. It's like you'll put that point, I'll stimulate this point, and the person will say, I got the sensation in my big toe. And that big toe may be the terminal end of the acupuncture meridian. And that's part of the symptom approach that we're looking for in the course of the treatment. We want to know that we're hitting it. We don't want to go through a rote process of sticking needles into it. That's not the, that's not the interaction that's necessary to take place. The thing is, we have a map, we have the tools that we need for the diagnosis, and then we need to carry it a step further and generate the physiological effect that you're looking for. So yeah. And sometimes I'll use the laser over the needles. The laser will stimulate the point. Yep. Any other questions? Yes,
Yeah,
ma'am.
Doctor, how long have you been involved with the acupuncture and the herbs?
Oh, how long have I been involved with acupuncture?
Right, and the herbs.
Oh, and the herbs.
Because you were doing the,
I was originally trained to do acupuncture in chiropractic school 19 years ago. So I've been in practice in Somerset here for 19 years. However, New Jersey has one of the highest standards regarding the practice of acupuncture than any state of the union. Meaning, as far as a consumer goes, if you're going to get acupuncture anywhere in the United States, you go to New Jersey. And because there's only 100, there's 100 and at this point 130 licenses. There's only about 60 people practicing in the state. And they're all very qualified. They each have to have at least 3,500 hours of education. So the board certified acupuncturists are very well trained. So I had to go to a separate school, separate full-time school for acupuncture, and then bring that into my practice. Well, the minimal requirements that I got through chiropractic school weren't enough for this state. You had to go for a separate, you need a degree, and then you go for a separate 3-year, full-time schooling for 3 years. I'm pretty involved with acupuncture, though. I'm the president of the Acupuncture and Oriental Medicine
so how long
Society.
have you been?
Oh, 3 years here in Somerset.
3 years?
Yes.
And you
The
talked
herbal
about-
medicine I've been doing since I've been in practice. I've been doing herbal medicine. But
You talked about being
but the
in China.
focus, that was last year. I was in China. But that was more for postgraduate. I've been doing that's for postgraduate education, because the whole thing of acupuncture anesthesia, you really can't get good training here in the States because they don't use it here, because we're too interested. It's a very much cost containment going on now, and that's the reason why you don't see so much acupuncture anesthesia, because it's much easier to put the person under with utilizing drugs and have them wake up than it is utilizing the acupuncture. But why I wanted to do it, because I wanted to get the people that were sensitive to anesthetic and do the acupuncture for them, because there's certain surgeries that it works tremendous with. People that have knee problems, it works tremendous for that. You can anesthetize. I've anesthetized a person from the waist down, no problem, using acupuncture. You can go and do anything. You can do a lot. You can do and utilizing electroacupuncture too. So it does take a while and it does take a while. So sometimes it may take an hour to start to anesthetize an area. But the application is really there, because if a person is sensitive to medication, I want to be that person that helps them with that. And as I mentioned earlier in the program, I said if I could do anesthesia to a given area, I really think that I can master any of the other things that go along, because that's something that you can really tell. If you're affecting that good, then you're going to have effect using other things. So yeah, it's good to get acupuncture in New Jersey. The best state for that. The MDs that do acupuncture are not as well trained as the board certified acupuncturists. They have minimal trainings. So it's one of the few situations where you would think that your MD would have more training in acupuncture, but they don't. It's a person that went to school for regular full-time schooling for it has a much greater grasp of all of the things involved. Okay.
Do you know the costs of the different procedures that we
Well, that's good. All acupuncturists will work it. That's a great question. Acupuncturists will work it differently. The way that it is in my office, and the initial office visit is $75. That includes treatment if indicated. So I mean, if a person's needs acupuncture, we're going at it if they're going to be a good candidate for it. Depending on how much a workup needs to be done, if a person's really just not going to be a good candidate at all, I may not charge them at all, because they're just not going to. There's no use of taking that money. They're not going to respond. I usually know right early on. It's only if a more intensive workup is due that we would take the initial monies without doing treatment. Any further treatments, $50 a treatment. Now that's a global fee. I don't do like an a la carte thing. Well, I'm doing this, so I'm going to charge for that, and $10 for this, and $15 for that, and $20 for electro. $50. That is a reasonable fee, and the reason for that is that it makes it. I found that whether people have insurance or don't have insurance.
Is some
This way.
insurance covered?
Yeah, the majority of people have insurance that covers acupuncture, and that's an advancement. Medicare does not cover acupuncture, and then the practitioners have certain arrangements with insurance companies where they're going to reimburse me a certain amount. Sometimes, because my fee is on the lower end at $50, the average $75 a treatment in the state for a board-certified acupuncturist. The average MDs, it's $135 a treatment. But they're working all kinds of different insurance things and stuff like that. But the majority of times that people have insurance that covers my care, and I have from cash payment. And usually it's never that way with insurance, and managed care you get paid less. But since I'm charging less, some I get reimbursed more, and I'm happy at that. Okay, I don't want to beat everybody to death here. If there's another question, I'll take that. Yeah.
Might it help in the case when you have radiating pain from a major joint that you have osteoarthritis in, but there's no cartilage?
That could be tough. That could be tough. I mean, acupuncture is not going to take a bad part and make a bad part a good part. It can increase pain-killing chemicals that will help to reduce the pain or magnify the effect of either anti-inflammatories or pain-killing medication. But if like the hip joint is totally deteriorated and degenerated, and there's a lot of pain emanating from there, it may be a management tool and not a corrective device, which means that there may not be an end to the need for acupuncture, meaning you may need it occasionally. A person may go through a core sequence of treatments, and then they may need it once a month. I mean, I hate to use the thing maintenance acupuncture, but when the underlying problem is still there and it's still working against against the effect, it may need some type of thing. But chronic.
Just taking NSAIDs too until you just have to.
Well, the thing is, there's no. Well, that's true, and there's not the negative side effect. But my thing is to not doctor people forever. But certain things do have limitations, and they need to be, it does need follow-up treatment. If the effect is beneficial, then that could be, something that's a supportive tool for the problem. Yes.
Would you recommend a weight loss acupuncture for someone that's rather obese?
Well, that's always very interesting. I mean, yes, but a lot of that is in the eyes of the beholder, because I have people that come in for it who what are you doing here? I mean, they see themselves as they may see themselves as really like overweight at 10 pounds or overweight at 8 pounds. And then I have people that are hundreds and hundreds of pounds overweight.
That's what would you recommend?
Sure, I'm always trying to get that, because I'm figuring that if they were coming in to see me at that point, they've done many things and have a lifelong struggle with food. And if Weight Watchers was going to do it, it should have done it before they got that bad. Although I was driving to work the other day, and they had a Weight Watchers commercial on, and they were saying, our people have lost 23 million pounds. And I said, that's incredible, 23 million pounds. I said, that's a great program. I wish I had something that I could say, my patients have lost 23 million pounds. But yeah, I mean, if they've probably tried many things, and not to use acupuncture as a last resort, but they should do as much as they can.
You wouldn't turn her away.
No. I mean, I wouldn't say, well, you're too overweight
Right, that's what
to change. Yes. Yeah.
Sorry to everybody.
No, it's not a problem. I just don't like to wear any, but I don't like. I like to end on it. Oh, no, I don't want to. No, I can't wait for people.
You mentioned premenstrual syndrome.
Yeah.
What about fibromyalgia syndrome? Does that come into play with any of the patterns that you mentioned before? Where there's specific patterns, like the pain between the shoulder blades, or
Well,
chronic
right. That's a musculoskeletal problem. one of the top 10 things treated by acupuncture and Chinese medicine. Thank you for coming. And it has a variable causes. Early on we talked about Lyme's disease as a cause of that, which we do a lot of treatment for. We talked about autoimmune diseases that can cause myofascial problems. Sometimes scoliosis or structural changes in a person will cause that to occur. Sometimes it can be chemical, but yeah, it's one of the most commonly treated things. Sure. And referral patterns and just an adhesion buildup in muscle tissue. This is what all this treatment's for. This is, I mean, it's not, we may use a lot more needles, but in a regular treatment, but that's what it's about. Yeah.
Thank you.
Okay.
One more question.
Yes, ma'am.
My son has a bad back. I mean, he waits a while and it improves from heavy lifting. Would that, the acupuncture help that? He lifts very heavy things sometimes in his work.
I would use, well, I mean, if he's doing that, I mean, the first thing I'd recommend is that he makes sure he lifts properly. He's using, some type of back support to, to cut down on that. Is on a good exercise therapy. Isn't overweight, and then considers utilizing acupuncture if he gets himself in trouble. Because he's under constant exposure to the possibility of blowing himself out, per se.
Yeah.
I wouldn't go and then utilize acupuncture as a supportive tool because he's still going to be, the stressor or that problem is he's still lifting those trucks up.
Well, he's going to cut down on that. But
yeah, that's what he said. He'll be doing it his whole life. Yes.
Have you ever treated anyone with reflux sympathetic dystrophy syndrome?
No. No. I mean, I don't know, what, I know of it, but I've never, I haven't had anybody come in with it that I've treated, and I haven't, a lot of the things that I have a computer system that so much has been written on acupuncture and Chinese medicine that I can tell a person what the percentages is of acupuncture's efficacy for their condition, so that they can make a judged, it's not like, well, I'm saying that it's, everybody gets well from, my treatment. I mean, there's a lot of studies. That's all they do in China is these studies. So I haven't seen anything that relates to that condition for, within Chinese medicine. But it doesn't mean that it wouldn't help you, but I wouldn't have anything to back it up to say, yeah, it's one of the more, it's in the top 10, because it wouldn't be.
Because I know the medical doctors we've seen have suggested alternative therapies for pain, and acupuncture possibly being one of those.
Well, I mean, its physiological effect is going to do all of the things that I'm saying as far as, managing the pain, decreasing inflammation. That's global, regardless of the diagnosis. But usually when I get asked a real laser question, I want to be able to give a real.
Well, he said the problem sometimes with the ice cold hand, the ice cold foot. So I was very interested when you were.
Yeah, I just haven't, I haven't treated it as a specific diagnosis. So, but that's something that you may want to investigate. I'll give you as much information as I can, as I can. Yes.
Now, are you timing how long these are in?
I'm just rapping on and on at this point.
When you take them out, will they feel the needles coming out?
No.
No, I mean, well, let's take a needle out.
oh my God, what happened?
Did you feel it?
Sometimes, depending on the point that we're needling, there'll be a drop of blood. Sometimes, 99% of the needles, when you take them out, there's no blood in or around the needle. A side effect from acupuncture is that could you get an occasional bruising in and around that point? Certain points that are really powerful points have a lot of blood supply going in and around that area. Sometimes you can get a little bruising with that. It's rare though. I mean, and we explain that to a person when they come in. They sign a little form that lets me do whatever I want to do, and say that it's okay. But really we pay very much close attention to what it is that we're doing with them. So we know where parts are and where you can needle and where you can't needle.
So do you save those needles and send them back to China so they have more? So they can use them. I didn't know if that's something you
Well,
would
that's,
do.
no, well, yeah. My cause, they don't be my personal cause. No, actually, the ones that you autoclave are a lot thicker to begin with, so they're really industrial than the disposable ones. But I tell you, the problem with those autoclave needles, each time you use a needle, it gets duller. And when there's a big difference between, every time you stick that in, it gets duller and duller and duller, just like a regular knife. And I tell you, when we would stick these things in, you would, also they don't use what's called guide tubes. They just take the needle and you just put it in. But the Chinese people are a lot more tougher than we are. But I mean, you can feel that when it's going in. I mean, it's just like, this ain't right. This ain't right. Just because it's, you know, there's, when the needles are bad like that. Yeah. But they're very stoic. They can take it. They can take it.
It works for anesthesia though, huh?
Yeah. Oh yeah. Oh yeah. And that's a good validating tool for it. I mean, if I can stick a needle in here and manipulate it, the person can't feel any sensation in their upper gum. Yeah, they kind of get the correlation that I think something here has something to do with something there. And I try to make a point of that when I'm doing different treatments and different things on people. Thank you for coming. And there's some information in the back if you'd like some information. Call the office and.